The Code of Ethics for CRNAs serves these functions. It defines the ethical values and responsibilities of the individual CRNA and the profession of nurse anesthesia as broad principles of conduct and professional ethics. The American Association of Nurse Anesthetists is a vital resource for CRNAs and RNAs. The AANA offers a variety of education and career development resources, including webinars, online courses, and annual conferences, in addition to the information on the certification. In addition, they offer a directory of certified registered nurse anesthetists and members of the American Academy of Anesthesiologist Assistants, which can facilitate connections and mentoring. The potential for cost savings in maintaining an anesthesia service line increases as CRNA utilization rises, according to research and practical applications of data. The 2018 simulation compared average anesthesiology demands across all nations and anesthesia demands. Despite the fact that revenue and costs vary by setting, it was determined that anesthesiologists and CRNAs had the same revenue, while anesthesiologists had at least double the cost of CRNAs. The simulation concluded that, while not always possible, CRNAs acting independently are without a doubt the least expensive per procedure and generate the most net revenue. In light of the prevalence of physician personnel shortages and the continued tightening of hospital budgets, it is time for health systems to reevaluate their anesthesia delivery model in order to maximize cost savings. Where permitted, this may mean that the CRNA-only model deserves significant consideration. The primary benefit of CRNAs is their affordability. Consequently, CRNAs are frequently the most cost-effective option for services requiring anesthesia. In addition, CRNAs can often provide greater patient satisfaction than physician-only or physician-led models, as they are typically more available and accessible than physicians and are more likely to spend more time with patients. As mandated by the Council on Certification of Nurse Anesthetists, CRNAs must earn at least a Master of Science in Nursing and pass a national certification exam to be considered clinically competent. This certification process ensures that CRNAs have met rigorous practice standards and demonstrated a high level of competency. The ability of CRNAs to adapt to changes in clinical practice and keep abreast the most recent evidence makes them an attractive option for many hospitals and medical centers.
The relative lack of uniformity in the scope of practice across state lines has posed a great challenge for CRNAs. Political influences are often held to a higher regard than the available research and evidence, drawing a lateral comparison between anesthesiologists and CRNAs. Addressing professional groups with powerful ties to policymakers and legislators may not halt negative campaigns against CRNA autonomy, but they may provide more insight into the profession of a CRNA. There may also be inadequacies and a lack of support from federal and state governments, interdisciplinary teams of healthcare providers, and even consumers, which may deter forward movement towards an opt-out ruling. To promote changes in policy and advocate for autonomy within the profession, CRNAs should aspire to take on leadership roles on hospital boards and interdisciplinary teams in order to inform hospital administrators of their contributions to the healthcare system. By strengthening the knowledge base, an opt-out state would transition into a CRNA model with less of a potential for fragmentation amongst the team of anesthesia providers. Further research comparing anesthesiologists to CRNAs and specifically looking at patient outcomes, presumed cost and access benefits, changes in access, and facilitation of anesthesia services would be useful data in support of the November 13 opt-out rule. CRNAs and SRNAs have an opportunity and responsibility to advocate for their profession. Gaining widespread support of federal and state governments, healthcare professionals, and consumers may all pave the way to advance autonomous CRNA practice.
Access to care in rural areas of the United States is significantly diminished when compared to more metropolitan areas. By supporting Florida opt-out, CRNAs and RRNAs will be able to meet the healthcare demand across the country, especially Florida. According to the U.S. Bureau of Labor and Statistics, as of May 2022, the demand and need for nurse anesthetists continues to rise dramatically. This trend is expected to continue to increase with the expectation and demand for CRNAs. The potential for cost savings in maintaining an anesthesia service line increases as CRNA utilization rises, according to the research and practical applications of data. Despite the fact that revenue and costs vary by setting, it was determined that anesthesiologists and CRNAs had the same revenue, while anesthesiologists had at least double the cost of CRNAs. The primary benefit of CRNAs is their affordability. Consequently, CRNAs are frequently the most cost-effective option for services requiring anesthesia. The ability of CRNAs to adapt to changes in clinical practice and keep abreast of the most recent evidence makes them an attractive option for many hospitals and medical centers.
There are many challenges that CRNAs face. One of the main challenges is ensuring that CRNAs are able to practice to the full extent of their education and training, while also maintaining high standards of patient safety and quality of care. This is of utmost importance. In an opt-out state, CRNAs are allowed to practice without physician supervision, which can increase access to care and reduce costs. However, this also means that CRNAs are responsible for making critical decisions related to patient care. Another challenge is ensuring that CRNAs are adequately trained and prepared to handle complex cases and emergencies. This requires ongoing education and training, as well as collaboration with other healthcare providers to ensure that patients receive the best possible care. Other states may have different policies and regulations related to practice of CRNAs. For example, some states may require CRNAs to work under the supervision of a physician, while others may allow CRNAs to practice independently.